This video lecture is going to start chapter 15 on mental illness and cognitive disorders. This is going to be a very unique chapter in this book, whereas the others tend to deal a lot with organ systems that we studied in A&P 1 and 2. This one deals a lot more with the mind. And so we'll talk about some of the mental illnesses that can occur due to physical effects or psychological effects, emotional. We'll talk about cognitive disorders with a change in thought process. And so students tend to find this chapter very interesting, but it's also, bear in mind, it's going to give you a lot of new information that you're not familiar with. Be mindful that there's probably a number of misconceptions you may have as you read through the chapter. So take your time reading through this. Keep notes on, oh, I always thought this was such and such, and instead it's this. So pay attention to that, help make sure that you're writing good notes, keeping good learning on the correct terms and the correct groups of disorders. Now, as we take a look, we're going to cover an introduction to the chapter in this video. And for that, we're going to be taking a look at, as soon as this catches up with us, there we go. We're going to look at the overview is breaking down a lot of these disorders into groups. And that's going to be one of your most important details for this chapter, is as you learn the different examples we find in each one of these, pay the most attention to which group they fit into. So when I talk about obsessive compulsive disorder, you know which group it fits into. When I talk about generalized anxiety disorder, you know which group it fits into. That's going to be one of your most important details as you're building your notes and reviewing through this chapter. The other thing to bear in mind is that any one of these conditions can be found anywhere along a spectrum. So things like schizophrenia, things like major depressive syndrome, eating disorders, any one of these can be very minor or very major. I will present you the signs and symptoms of what would be considered the textbook example. So please don't be offended if I present something other than what you have personally or your family or friends have experienced. Understand that every case will be a little bit unique, but I'll present to you kind of the high point of what we'd see in a, as I said, textbook example of these different cases, of these different disorder groups. As you read through this chapter, again, you're going to see, say early warning signs and symptoms. A lot of this is very different than what you and I are thinking of when we're looking at cardiovascular issues or respiratory issues, musculoskeletal, digestive, and so forth. So it's going to be a very different chapter in that regard. Now, I always tell my students, no self-diagnosis allowed in this chapter. As you're reading through each of these different disorders, it'll tell you different signs and symptoms, and go back where it talks about sort of these, excuse me, early warning signs and symptoms. You look at somebody and think, oh God, some of those apply to me. Bear in mind that little examples of some of these, excuse me, excuse me, sorry about that, can be very common. But the point is, if these last long enough to chronically affect a person's behavior and mindset, that's where we lead into what we will consider as mental disorders. So don't fall into the trap of suddenly getting very paranoid because you demonstrate some of these characteristics in a very snapshot effect. So you are not allowed to diagnose yourself on anything from this chapter. All right. The people that can diagnose this are psychiatrists and psychologists. A psychiatrist is a medical doctor. This is the person that's going to diagnose the mental illness or the cognitive disorder. They're going to prescribe medical treatments, such as medications or surgery. A psychologist is a PhD. This is the person that's going to study behaviors and provide counseling, help you to be able to change your own personal behavior. So psychiatrists and psychologists have two very different approaches to this chapter. Be mindful when you talk to someone, visiting a doctor, what kind of doctor tells you what kind of approach they have and what kind of tools they have in their quiver. The big book that we always refer to is the DSM, the Diagnostic and Statistical Manual of Mental Illness. This is the book that's agreed upon by all the big psychiatry and psychology groups, and they will categorize different disorders into groupings based upon signs, symptoms, treatments, and prognoses. And every several years, they go back and they rediscuss and re-argue and decide to put in this and put in that. I believe the most current, I need to update this. I say the DSM-5. I think the DSM-6 is out now. And so bear in mind if you ever see one of these, it's a big book. It's bigger than your A&P textbook that you used back in Bio 201 and 202. Thick book. You can find little pocket versions that can hit the high points of some of the major groups. And so those would be a very valuable tool to have if you go into a branch of medicine that deals with any of these issues. Now, to diagnose a mental illness or a cognitive disorder, a change in thought process, you'll perform a very thorough history and physical, and we'll look at some of the examples of how this is different than what we'd normally see with a quote, quote, anatomical and physiological disorder from the body itself. You can use certain technological visualizations like X-rays, CT scans, EEGs, you can do MRIs, PET scans. You can still look at a number of ways to look at the brain to see if it's reacting differently than expected. You'll take a family history, be able to determine if you have a past history or a family history of different disorders. Mental health exam and a psychosocial history are pretty much unique to this chapter, and that's where I show you a few tables demonstrating from the book some surveys you could have the person fill out, or some of the things that you as the healthcare worker would observe that could be beyond what you would normally do for something where you're suspecting purely a respiratory issue or a cardiovascular issue. As you read through these tables, don't get obsessed on this. I'm not going to ask you to describe each one of these in clear detail. These are simply to help you understand that we would gain a lot of good information through a thorough examination, history, and physical, give you an idea. But don't worry about trying to like memorize these tables. I'm not going to ask you to reproduce these per se. That's not our purpose. Once you've diagnosed your patient, we want to be able to treat them. And so we can use psychotherapy, counseling, behavior modification, different techniques that have been developed over the years to help a patient to be able to reform mental behaviors and patterns back into what we consider to be a normal, healthy rhythm. We find that a lot of cognitive disorders and mental illness may be due to a neurochemical imbalance. They may have a lack of certain transmitters like dopamine, or they may have too much of certain transmitters, and that can cause a change in their thought process. And so we can prescribe medications to either enhance a deficit, to compensate for a deficit, or to reduce an overproduction. In case it's due to a neuroelectrical problem, we may even go in with brain stimulation. We can implant a little stimulator that can help strengthen a structure that is not working well enough. Or it may actually try to interrupt something that's overworking. For example, you may have a patient who suffers epilepsy, and those seizures may be causing cognitive malfunctions. We can use brain stimulation to interrupt those electrical storms and bring the person back to a normal cognitive function. A couple of terms that we're going to use extensively through this chapter that you want to be very familiar with. First of all is emotional state. Emotional state is the behavior that a person has, a mental behavior that is conditioned from constant use, constant reinforcement until it's automatic or innate. So if your patient has a very depressed emotional state, then their thought process is very subdued. They're not very reactive to stimuli, people talking to them. They may have a very exaggerated emotional state where they're very defensive, either in a very positive manner or a very negative, combative manner. They could have a flat emotional state. And so that's where they just don't seem responsive at all. They don't seem to react. The emotional state is what they are feeling themselves, and affect is the outward expression of the emotional state. This is what you, as the healthcare worker, would experience. So as you're surveying and interviewing your patient, you're going to see the affect, and using that, you're going to try to determine what their actual emotional state is in order to help diagnose the issue and be able to help treat it. So pay attention to the difference between emotional state and affect. Now, I do want to also quickly mention that a lot of cognitive disorders, a lot of mental illnesses can be comorbid with physical illnesses. And so, very commonly, if your patient has some type of chronic physical ailment, emphysema, cancer, diabetes mellitus, hypertension, all of these can very commonly enhance a mental illness, or the mental illness may drive their behavior to cause a physical illness. And so that's why we need to be mindful. We need to be watchful of our patient. Your patient has severe COPD. Okay, you're going to treat the respiratory issue, but pay attention to their emotional well-being. Your patient who is very depressed, and you're trying to help them with psychological assistance there, psychiatric assistance there, don't ignore the body. There may be physical details that are making the depression worse. And so that's, bear in mind the comorbid nature. All right. When we look at causes of mental illness, we can look at 5 major groups, and we can see how these can all contribute to help change a person's emotional state, change their affect, and lead to some mental illness. An example would be, again, the emotional state itself. If you have, constant highs beyond normal, constant lows beyond normal, flats that are unreactive, massive bipolar fluctuations, all these are going to alter or interfere with proper mental function. We can take a look at the patient's environment. This can have a huge impact upon their mental state. Socioeconomic, if they've lost their job, can't afford to keep the house, become homeless, that will have an impact. Familial, if their family environment changes, the loss of a loved one, your empty nesters and your kids have all moved out and that suddenly changes. You could, get married and that makes a change to your environment. You could have children and that makes a change. So the changes don't have to necessarily by themselves be negative changes. They can be positive changes and still have an impact upon your mental state. Seasonal changes. Some people are very reactive to changes in the weather. And so summertime, they love the pieces and they're horribly depressed during the winter. Some people are vice versa. Some people just hate wind. Some people just hate rain. Some people, it can vary from person to person. So bear in mind that a person's environment can have a huge impact. Biological imbalance, that's in the patient's body themselves. Again, I talked about neurotransmitter levels. If your patient has some imbalance in their dopamine levels, they could have a brain tumor that's overproducing serotonin. That could have a huge impact. Nutritional status, if someone is malnourished, or if they've been consuming way too much of something, that could have a change. If they change their diet, someone who's eaten a lot of protein out of meat for years and years suddenly swaps to a vegan diet, they're not careful, that's going to have, at least a short term, huge impact upon their neurologic function. Hormone levels. Again, you could have a tumor, you could have medication that changes hormone levels. The bottom one says age related. When you go through puberty, that's going to change hormone levels, that's going to change mental levels. Menopause could have a big impact. Pregnancy could have a big impact. Genetics and heredity. You may inherit a genetic predisposition towards a mental illness. You may have something that makes you more prone to a certain behavior, or may even protect you so that you have less chance of developing this mental illness. We can look at isolation of the patient. And so if you suddenly get a job that takes you away from your hometown and you're in a brand new location, that's going to have a huge change of your environment. And that's going to have a big impact upon your mental well-being. Social isolation, if you suddenly get a job, or if you lose a job, if you get divorced and suddenly you find that all of your friends were more your partner's friends and suddenly you're left out alone. If you suddenly get the night shift job at work and all of your friends have the day shift job and you can never connect with them. So all sorts of isolations at different levels can occur. And then we can also look at simple life changes. And I've already hinted at several of these, but as I said, job changes, marital status, your own health changes. You know, you bought a season pass to the ski mountain, and on the first shot down, you trip, fall, break your ankle, and you're out for the whole winter. Yeah, that could wind up having a big impact upon your mental status. The family status, you know, either a family getting bigger, getting smaller, some horrible event happening to someone, some fantastic event happening to someone. So there's a lot of things that can go into causing mental illness. So keep that in mind. Review through those 5 categories and on a test, be ready to explain examples. I'm going to show you this table really quickly to kind of re-emphasize, as I mentioned, neurotransmitters can have a huge impact. I'm not going to go into neurotransmitters simply because there's so much information that to do it justice, we would have to add about another 6 hours of lecture to do it justice. And we would get into so much pharmacology. So I'm simply going to acknowledge in general, neurotransmitter levels can have a huge impact. And we'll stop there. If you're interested in specific examples here, then by all means go look at it, scoop me an email, but you will not be required to know specific neurotransmitters, what their actions, locations, and disorders are. All right, that gets us started looking at the causes and the diagnosis of mental illness and cognitive disorders. The next several videos are now going to look at each of these individual groups and show us some examples and give us an idea of some themes, as it were, that we'll find within the various disorder families. Take your time through this chapter. It's a way different mindset, and so be aware of that and let me know if you have any questions. Good luck.